Good afternoon, everyone. Welcome to the Illinois Power Agency's third Power Hour webinar of the year on climate change and health equity. My name is Megha Hamal. I am the Chief Strategy and Communications Officer at the IPA, and I will be hosting the presentation today. To get started, let's go over some housekeeping items. To reduce any background noise, all participants are muted upon entry. We will be taking questions towards the end of the webinar, but please feel free to submit your questions anytime during the webinar on the chat box at the bottom panel of the Zoom window. Today's session is being recorded, and a recorded version of the session will be available on the IPA website under About IPA Events. Couple of points that I would like to emphasize before we start. Today's webinar is for general education purpose only and does not represent a legal interpretation or statement of policy by the IPA or its staff. This 60-minute webinar will explore the connections between climate change and public health with a specific focus on equity. With the Earth Day taking place on Monday, April 22nd, and as the agency's commitment to equity, we wanted to take this opportunity to shed light on the climate change and its risk and impact on public health, especially on environmental justice and underserved communities. I would like to now give you an overview of the IPA Power Hour webinars. If you're new to our webinars, Power Hour is a series of educational and informative webinars that started back in 2021 when the Climate and Equitable Jobs Act, also known as CEJA, was passed. To date, the agency has hosted 30 Power Hour webinars on a range of clean energy issues and topics, and we've invited energy thought leaders and experts locally and nationally to speak on these topics. If you want to take a look at our past webinars on various issues, that's the link that we've presented here in the presentation. You can just simply click it and it will take you to an archive of past webinars. Those who are new to our webinars and our agency, here's a quick overview of who we are. The Illinois Power Agency is an independent state agency created by Illinois law in 2007. We are responsible for the development of the electricity procurement plan, which serves as a roadmap for customers of electric utilities. We also support the Illinois Renewable Portfolio Standard, which is state policy designed to implement renewables. And we support the RPS through the creation of long-term renewable resources procurement plan, which serves as a roadmap for our agency's renewable energy programs and procurements. And we are also responsible for implementing and overseeing our two solar incentive programs, Illinois Shines and Illinois Solar for All. Now, I would like to welcome our wonderful speakers for today. Our first speaker for this session is Dr. LaVon Downey, Program Director and a Professor of Health Sciences at Roosevelt University. She's also a United Nations Global Goals Ambassador. Her research focus is on identifying and solving healthcare issues, the underserved health policy, mental health, vaccinations, vaccine hesitancy, mental education, and global health. She teaches a range of classes, including public health, medical ethics, health economic, health policy, and global health. Today, Dr. Downey will be discussing how health equity and climate change are connected. Welcome, Dr. Downey.
Welcome, and thank you everybody for joining us. I know that some of my previous students are online or people that I work with, so they've heard me go on and on about all of this. And as I was telling everybody before this started, I was literally this morning in educating people about global vaccines and how climate change has impacted why we need a malaria vaccine now, right? So all of this is very, very much related. And one of the things that I think to think about more broadly, but it always comes back to the local level, is that one of the focuses that we've started to think about is health in all things. And that means that it's not just you as an individual are healthy, but the places you live promote that health. The structures promote that health, the institutions promote that health, and that everything has a connection back to health. I won't sing the song I have about the global goals and how they're all connected to health. I can certainly later send a video, but it's fine. As you can see, my poor students get to see all that, right? Of how I
Yeah.
connect everything else back to health. But one of the things that I really want to
Dr.
focus.
Down, may I just quickly finish my introduction and I'll give you the floor.
Okay, sure.
Okay, yeah. All right, thank you. So our second speaker for the session is our IPA Deputy Legal Counsel, Sarah Duffy. Prior to joining the IPA, Sarah worked in the state energy and climate policy space for over 5 years, most recently as a North American Government Affairs Manager for the Under2 Coalition, a global network of state and regional governments leading on climate action. Sarah previously worked for Georgetown Climate Center and for the Emmett Institute on Climate Change and Environmental Law at the UCLA School of Law, where she was a Shapiro Fellow. Today, Sarah will be talking about health indicators and EJ designation for IPA programs and procurements. Welcome, Sarah. Our final speaker is Elena Grossman, Program Manager for the Community Benefits Team at GTI Energy. In this role, Elena brings her public health, climate, and health equity lens to oversee assessing how an energy transition will impact EJ communities from a labor, economics, health, and pollution perspective. She's also a lecturer for the Yale University Climate Change and Health Certificate Program, teaching the Climate Adaptation and Human Health course. Additionally, Elena was part of the UIC Community Research on Climate and Urban Science team and served as the program director for the Building Resilience Against Climate Effects in Illinois, also known as BRACE Illinois project. And in today's webinar, Elena will explore actions taken to address health equity in our changing climate, both locally and globally, and highlight some case studies. So with that, I want to give the floor to Dr. Downey to begin her presentation. Thank you, Dr. Downey.
Sure thing. And again, welcome everybody. Thank you all for taking the time in your lunch to spend the time with us. And we all offer a unique perspective, but I'm sure there'll be overlap. So some of mine will be a bit more broad stroked with some local examples, but it will certainly set up the tea for everybody else. As I said before, one of the things you need to think about is how is climate change, how is health related, and what does it mean about health equity? First slide, please. Next slide. And one of the things, as I talked about before, is one of the things that we want to look at is health in all things. And that means that we don't just work on one component, we work on all the components and we look at how they work together. So it's not just air quality, it's why is that air quality bad? How do we get an alternative? Why is there flooding? How do we change streets? Why do people not have access to healthy foods? Then we look at, is there a food desert? So it's all very much connected to getting that one health outcome for everybody. As we know, health equity means does everybody have access to the resources that would allow them to live to their healthiest potential? And one of the things that I think when we focus on health is that all of us understand health and healthcare from a personal perspective. So I think it's a really great lens in order for us to view, we want our health, we want everyone to have health. And if you don't have health, then you cannot necessarily fully participate in the care of yourself, of your family, of your community, of the whatever work you engage in, and the wider community. So we do need access to health. And it would be very prescient of us to make sure that everybody has access to it, because we are impacted when other people don't have access to it. Why should we care? There are lots of reasons why you should care. You should care because we don't just stop. It's not like climate change only affects and stops at a certain border. If there is air, then we are all at a heightened risk. If it will cause asthma for one location versus another, we're still getting the impacts of that air, maybe not as much. If we don't all have access to healthy foods, then we can't all thrive. If we don't have a healthy infrastructure, then even if we wanted to, through our best efforts, make sure everyone's healthy, and then people are better workers, better at school. So you really have to care because everything is super connected. Next slide, please. So health disparities already exist, and I will give you an example of that, a local example. Until they shut down the coal fire plant, there were certain communities to which we don't, in the United States, we don't have the highest level of asthma. However, two hospitals, Stroger and Mount Sinai, had the highest level of adult and pediatric cases that had to be hospitalized and or unfortunately led to death due to asthma. And that was almost directly related to the fact that those individuals lived near a coal fire plant that produced electricity. That electricity wasn't just used by that community, that electricity was used by a wider community, but they had the highest level of negative impact from them. We have seen since then, it's still a little early days, but we have seen once that's shut down or reduced, that we are no longer having such negative health outcomes. So there are true impacts for people when they live close to those areas. One of the things that I've sort of alluded to in that is, how does the lived environment that people live in impact their health outcomes? Well, if people live in a place with less access to parks, there are no sidewalks, then they are less likely to be able to go out and exercise. They are more reliant on cars, which will do more fossil fuels. So it sort of snowballs. And one intervention, and one of the reasons why I want you to think broadly about that is, one intervention does impact other things, but it's not one intervention and we're good. It's not, we'll give everybody electric vehicles or we'll give everybody access to clean energy. It is certainly related, and certain things have a bigger impact than others, but there's no one fix and we're done, which is something that people have a very hard time with. Now, if we look at globally, those people who are less responsible for creating a negative carbon imprint are often the ones that are most impacted by global warming. People who live near the coast, whose livelihoods go away, as in we saw in Chicago, people who live near places that the coal fire plant, they had the biggest health inequities and negative health outcomes from that, even though there weren't the highest incidences of asthma in the United States, because that's in Harlem. So people who have the least input into these things have the worst outcomes. They're also more likely to live close to places such as highways, so they get more of a negative impact from other fossil fuels from the environment and on their health. They're also more likely to live in places where there's food deserts. So they're also not able to go out and access healthy food. They also necessarily don't have the highest level of schools, and those schools mean that they can't access education. So all of those things impact those who have the least access to resources and the least impact on negative climate outputs. They get impacted the worst. So it's already existing. The negative impacts are already being felt by these populations. And even if we think we're outside of that, they do impact us also. Next slide, please. One of the ways that the United Nations has sort of addressed this is with the Sustainable Development Goals. And I know a lot of people don't know what they are. There's 17 of them. But one of the great things about them is that they're all very connected, right? And we've talked about how that the impacts of climate change and over-reliance on carbon-related fuels has definitely caused health problems here. But that's also related to the goals. And some of the goals are straightforward, like we need cleaner air, better health under seas, things like that. But we can't get one without doing the other, right? None of this exists in a silo. And climate change just makes that so much worse. I will give you an example from our recent existence. So a lot of you, whenever we were in the pandemic, a lot of people and a lot of news coverage talked about, wow, there are all these animals that are coming out. We saw animals in Lincoln Park and the north side that we never saw before, and they're roaming at night and they're doing all these kinds of things. Correct. And one of the reasons is we're on their land. We have encroached further and further out into the suburbs. We have thus put ourselves in contact with things that have existed before, but because now we are in that land, we now have diseases and illnesses that we have never seen before. So tick-borne illnesses, because we are further out in nature in places where they existed before, we are getting these viruses. Also, you know, the air quality. So one of the things that it's a little bit more complex, but whenever COVID came about, not only do people in less resource areas have less access to the sort of multipliers and impacts of health, but they also usually had worse air quality. And having worse air quality meant that you were more susceptible to the impacts of any virus that was a respiratory virus upon you. Sort of like the thing that we talked about with asthma. So you're going to get a lot of individuals and people that built-in impact of inequalities is already in place, and anything else in addition to that is going to impact them worse. So all of these things mean that we need to we need to look at what we're doing, and not just in a silo, but in how that impacts everything else. A lot of viruses and things that we see are because we are going further into nature, as I said before, but we're also coming in contact with animals who've always had these viruses, right? So we need to rethink how we build out, where people can live, what is the impact of where they live on the lived and the environmental infrastructure that is already in place. We also need to look at what are the impacts of all of the SDGs working together. We can have cleaner air, but we also need to make sure that we have a government that can enforce that, a government that can put incentives in place to try to get other people to also make the air cleaner. Because again, one of the reasons we talk about air is because it doesn't just stop at a geographic boundary. Yes, people who live in certain places get more negative impacts from unhealthy air, but it does impact all of us. As we saw actually last year, right before the 4th of July, those fires in Canada impacted the fact that we couldn't go outside in late June, right? So there's no sort of shield that's going to protect us all from that. Obviously, we were impacted not as much as people closer to it, but it still impacted all of our health. And people who already had asthma were impacted more, and they would be the people who ended up going into hospitals. Next slide. So one of the things that we need to sort of think about, and I alluded to, was how does climate change amplify these health inequalities that are already in place? And how do our solutions, on the reverse sort of other approach, how do our solutions improve and help negate those health inequalities? Is it enough to just do one improvement, or do we need to look at it across the board, all the SDGs? Do we need to make sure that, you know, that there's less plastics so that we get a healthier sea? Will that impact everybody else's health? Yes, especially people who try to live from the sea and that's their source of food. Those things are impacting them the worst, right? Do we make sure that everybody has access to healthy lived environments like air, and they have access to quality education? Yes, because that will improve and negate some of the health inequalities that are in place and allow people to live their healthiest lives. We need to think about, when we build into an environment, what we are impacting, right? So the further out we move into nature, we need to understand that we're going to come into contact with things, right? And as we've seen with the avian flu, birds fly globally. So anything over there is going to be here, whether it's through birds and people, because literally O'Hare is one of the places we are, I think, the most 24 hours within reach of some of the most remote villages. So there may be isolated things that they come in contact with that they can certainly bring to our airports, and we can experience that. So it's not, I guess, even if you don't care about others, which I know everybody on this does, but even if you don't, caring about the environment, caring about reducing these health inequalities, making sure that everyone has access to the healthiest lives that they can have is beneficial to us to keep us safe. Even if we're not so involved about making everybody else safe, because I realize that that we should do this because it's the right thing to do is not what always sells to everybody. And you've got to meet people where they're at, right? We also sort of have to look at, do we coexist with what's there, or do we continue to destroy it, negate it, and not build up systems that can support health? Next slide. So I've given you a lot of bad news about how everything's connected and we have to work on all kinds of things all at once, and there's no quick fix, and there's no one intervention that's going to solve everything, and that we've got to think about all we do and think about wider impacts to other populations. So I don't want to just leave everybody with everything is burning, because it is. But one of the sort of low stakes things we can do is invest in alternative energy. Report after report talks about that the sort of biggest impact on the quality of our health and the quality of global warming, which does impact everybody's health, is fossil fuels. And so if we can move away from them, we will have the biggest bang for the buck. And the alternative energy is cheaper and more accessible now than ever before. That does bring up the question of who should get access to it. One of the things that's wonderful is that with certain legislation, we have seen that people who have less resources are going to be able to get more access to it. And that's one of the reasons why Illinois Power Agency is such a great, innovative partner in this, because they are very much that link to places that may not feel like they've been part of the policy problem, for sure, and part of the policy solution. So that connection and those agencies and organizations that are helping bridge that gap are really, really, really important, so that we can reduce health inequalities at the same time as we give people access to the tools to do that. It's not enough that it's just in one place. One of the probably harder lessons to learn is we have to move beyond how does that impact me to how does that impact we. And we have to sort of think bigger picture and less about just how that is going to change my life, but how that might change the lives of others. And I think part of that is that we realize that and I know this sounds very hippie-ish, but we do belong to each other. And one of the ways you can actually see that is that globally, everybody is being impacted by climate change in a negative way. Everybody is not safe unless we are all safe. And it is really incumbent upon us to make sure that everybody has access to the tools and the technology so that we can all live the best, healthiest life we can, and ensure that what we're doing doesn't not just destroy in the future, but destroy as we go towards the future. Thank you.
Thank you, Dr. Downey. That was wonderful. And just sort of seeing the interconnection between climate change and health equity. That was lovely. Thank you. Our next speaker is our very own IPA Deputy Legal Counsel, Sarah Duffy. And Sarah will be talking about health indicators in our programs and procurement. Sarah.
Thanks, Micah. You can go to the next slide. So when it comes to how the Illinois Power Agency considers health, perhaps obviously it's not the main center of our authority. We cover energy resources, but there are a lot of health impacts of how we produce energy. And there are several ways that we try to, one, take the health impacts of the projects that we support into account, and two, take the existing health burdens of Illinois communities into account when we are deciding which projects to support. So I'm going to go over those two main kind of pathways or lenses through which the IPA thinks about the overlap and intersection of climate change and health. So if we go to the next slide, I'm just going to give a really quick overview of Illinois Solar for All. So this is a really key part of the IPA's efforts to increase the equitable distribution of solar resources and the benefits of clean energy. It's our income eligible program, so serving low and moderate income communities. There are residential and non-residential categories through which participants can access the benefits of solar. But the key part that I'm going to be talking about is this last element, where the program has a built-in consideration of climate and equity health by reserving 25% of the budget for each of these sub-programs for environmental justice communities. So go to the next slide. If you don't know what an environmental justice community is, Illinois law has a number of different definitions, actually. So Illinois EPA has a definition. There are different definitions based at the federal level and in different states. For the purpose of Illinois Solar for All, we actually developed a methodology for identifying what we believe represent the communities most burdened by past practices of the energy industry. In our first launch of Illinois Solar for All in 2019. So that has been in place since then. The Illinois Commerce Commission approved that methodology, and that's what we have been using. We base this on data from both the US Census. So we recently updated this based on 2020 census data, and something called the US EPA's EJ Screen tool, which is a publicly available data set on various demographic and pollution indicators. And we combine all of this data to get kind of a comprehensive view of the vulnerabilities and the health burdens of communities across Illinois. So we take the top 25% of the scores. So we look at census blocks, and the 25% of census blocks that have kind of the highest burden based on these factors are designated as environmental justice communities. So the demographic indicators that we use are listed here. We base this information again on these two data sources. And then if you go to the next slide, we have all of the health indicators that we use. So things like diesel particulate matter, so communities that feature a lot of trucking routes and warehouses will often be burdened by higher diesel particulate matter, traffic proximity, lead paint indicators, Superfund and waste treatment, all kinds of things that have shown to have negative health impacts on those living nearby. So once we identify those communities, we create this map of environmental justice communities, and those projects located in those communities get priority when we are awarding incentives to support solar in those communities. So again, trying to rebalance the distribution of burdens and benefits in the state. Next slide. So of course, not every process is perfect. As I said, we're only using some sources of data. So we do have a process through which communities that are not within that top 25 percentile and therefore not designated an environmental justice community can request that the Illinois Power Agency consider them a EJ community for the purpose of Solar for All, despite that. So we have what's called the self-designation application process. We have a committee that reviews all of the applications that is not just of IPA staff, it also includes Illinois Environmental Protection Agency staff, community leaders, and various other representatives of key stakeholders. And some things that we have seen applicants, rely on in making their case are these other health impacts that we don't include in the initial evaluation for various kind of data comprehensiveness reasons. These data are not available to a certain level of accuracy for all communities, and so it's not really practical to apply it across the state. But where a community can show that they have these burdens, we will add them to the map and designate them as an EJ community. Next slide. So the other way that we consider health is through what our incentives for solar and wind projects that are utility scale. These are really, really large projects. We run what are called competitive procurement processes. We award contracts that provide REC payments for those projects. Now, the vast majority of those projects end up being in Illinois, but we do allow out-of-state projects to submit bids into those procurement solicitations, but only from adjacent states and only projects that can demonstrate that those facilities will directly, promote the state's state residents' health, safety, and welfare. And we have certain criteria for that. So next slide. So we look at 5 criteria that are laid out by statute, 2 of which are directly related to health benefits produced by those projects. I'm not going to go into all of the kind of economics and engineering modeling that goes into how we determine what the health models or the health impacts will be, but essentially projects that are adjacent to the state and that would end up replacing or decreasing the use of polluting industries in those adjacent states where those other generation sources normally are then emitting all of this pollution that drifts into Illinois. If they can demonstrate that they would reduce that pollution, then we will incentivize those projects. So these are just 2 examples of how IPA is considering Illinois residents' health in designing our programs. But equity is not just about these individual pollutant measurements, and we have other power hours where we discuss more about our overarching equity measures. So feel free to check those out as well. And I think that's all I have. Yep.
Thank you, Sarah, for going over how environmental and public health indicators are utilized to support clean energy in underserved and disadvantaged communities across Illinois. Our last speaker for the session is Elena Grossman, who is the program manager for the community benefits team at GTI Energy. Elena, the floor is yours.
Hi, everyone. Thank you. I am going to be off camera because I'm having some internet issues. So just to make sure that I stay online. So I am a program manager with the community benefits team at GTI Energy. I am also a lecturer for Yale School of Public Health, their climate and health certificate program. So I'm going to share some things that are going on in Illinois that we are actually doing to address the health impacts from climate change. Next slide, please. But before I do that, I always like to use Grover here to illustrate how it can be hard to connect with things that feel far away. If you think about when you are in interviews and you're asked, where do you see yourself in 5 years? We really hate that question because it's really hard to, can you go back a slide? To imagine ourselves in where we will be in 5 years, because it's not the here and the now. So now, next slide. And a lot of times climate change is talking about 2100, right? And that's really hard to connect with. So these are projected changes in heavy precipitation events in 2100. Most of us won't even be around in 2100. So it's really hard to connect with that. Next slide, please. But we do connect with what has happened. So these are just a couple of images from around Illinois of flooding events. There are many climate impacts in the state of Illinois. Flooding really resonates. Previously, before I worked for GTI Energy, I was at the University of Illinois Chicago School of Public Health, and I was the program director for building resilience against climate effects, which I'll talk about in a little bit. And I went around the state in the beginning to talk about climate change and its health impacts. And whenever I would come to extreme precipitation, I would get lots of nods because it has happened here and everybody really understood that it is getting worse and more frequent. And so we can see these images and we can connect with them and we can sympathize and maybe we can empathize. And there's research that shows the event that is geographically closer to us, we connect more with, but we still do connect with events that are going on in the other side of the country or even the other side of the world, whether they were wildfires in the Pacific Northwest or the floods in Pakistan. Next slide, please. And there's data to support this. So Yale has a program on climate change communications, and they conduct surveys annually. In fact, I think they do it twice a year. And I pulled these two questions out as it relates to this. So for the most part, almost 3/4 of this country believe that climate change is happening, but less than half think it's harming them personally. And this is really relevant when it comes to what are we going to do about it? Because if we don't think that something is personally harming us, then we might not be as likely to advocate for it or vote in favor of either policies or leaders who support whatever it is that is harming us personally. So I think this data is really important, and trying to shift it so that people recognize not to be a Debbie Downer, but that these have real outcomes on us and that we can do something about it. Next slide, please. So I am going to talk about what is going on right here, right now, not thinking about what's going to happen in 2100, but here in Illinois in 2024. Next slide. So as I mentioned, I was the program director for Building Resilience Against Climate Effects Illinois, which was a CDC-funded grant that supported our work to work directly with the Illinois Department of Public Health to help prepare the state for the health effects from climate change. And we did a number of things. I've kind of grouped them on the left. We provided a lot of educational opportunities to increase knowledge and awareness, both with children at the elementary school level, middle school, high school, college, graduate, as well as professionals. We helped expand the knowledge base through research. It was primarily research for practice, looking at heat hospitalizations rate by county, and then using that data to share with counties that might not think that they are at risk for heat, and then what they could do about it is one example. We also created a map of Illinois looking at the healthcare facilities in relation to floodplains to support planning purposes. We also helped design and implement adaptation strategies and tools. So the map that I just described was one of the tools, but we also looked at, we also disseminated surveys to understand how emergency preparedness and public health professionals would use that type of map and if it was helpful. And then the one that I'm going to highlight is promoting climate change and public health planning. So we supported grants to local health departments throughout the state to essentially facilitate strategic planning for climate change and health. And on the right, this was the structure basically. So the first session was really a lecture on climate change, on the health impacts particular to Illinois, and how equity is impacted by climate change. And then the next three were more working sessions and interactive. And so we facilitated a session on prioritizing the health impacts of most concern for their community and thinking about what are the social and health inequities that are occurring within their community. What are their priorities right now, trying to incorporate climate change into some of their public health practice so that it doesn't feel like additional work or an extra burden, as many local health departments are lack financial support and staff support. And then once they identified the health effects of most concern, we facilitated a process to identify strategies to address the health effects that they identified. And so thinking about what can they do, what's feasible. There are a number of considerations to think about when thinking of different strategies. And then finally putting together a work plan, and then we served as technical advisors to their work. Next slide, please. Oh, I'm sorry, I forgot to, there we go. Thank you. So these are just some of the outcomes of the strategic planning session. So on your far left is a screenshot of Kendall County Public Health Department, which is about 50 miles south of Chicago. So still pretty far north in the state. And there was one late February where it was super warm. And when it's really warm, as we experienced this past winter, people go outside in our area and they're in shorts and tank tops and they're loving being outside. And during our work with them, Kendall County, this happened, and Kendall County thought, you know, a lot of people go to forest preserves when it's nice out. We should probably do a tick drag. And in late February, they collected about, I think it's 30 ticks. And they notified the public. And what's so critical about this is that we're not thinking about tick season in late February. And so it's really letting people know that that season is changing. The middle is, it's an asthma breather's guide. That's for people who are working with asthma patients. This was created by Jackson County Health Department. And what was really great about this opportunity was that health department did not have any work related to asthma. And so they were able to put together this breather's guide. So now they had work and they had a resource around asthma, and then able to incorporate climate change into this guide as to how it can be a trigger and how patients can monitor air quality and why the air quality is worsening because of climate change. And then the picture is really just, in many ways, a train the trainer, where it was someone from Jackson County Health Department who was delivering a climate and health lecture at Southern Illinois University. So sharing the information that they learned with more current and future health professionals. And then the bottom one is a screenshot of an intake form at a health department that provides mental health services. And they decided to include a question about whether the patient who was coming in seeking mental health support had experienced an extreme weather event, as that can be a trigger for an existing mental health condition or trigger a new mental health condition. Next slide, please. The other, so that was at the state level. Now we're going to go to Chicago region. The Metropolitan Mayor's Caucus has put together 2 climate action plans. The first one you see was put out in 2021. You can you click to the next slide? And then the next one as well. We'll have them all up. So these are the 2. There was one that they put out in 2021 and one that they put out in 2024. They are both very action-oriented for municipalities. So at the hyper-local level, what can municipalities do to address climate change? And the image in the middle is from the Climate Action Plan of 2021, and you can see how they include heat and health. So, and this was just one page. They also had other climate-related conditions that impact health. And so these municipalities are able to see how climate change is impacting health, and then what can they do to address it within their municipality. Next slide, please. Now I'm going to share 2 built environment strategies. So when I refer to the built environment, there are a number of definitions, but it's basically people made. Right. So it could be parks, it could be planting trees, it could be how we design our community with sidewalks, our streets, to make sure that public transportation is accessible and safe. And so this is one example in the city of Chicago, where it's not necessarily just about public health, right? And an important point that I often will make is that a lot of the skills needed to actually implement the strategies to address climate change aren't necessarily public health superpower, as I like to say, but that strategy has so many public health implications. So the city of Chicago has a new program called Our Roots. It's about 2 or 3 years old now. And the whole purpose is to plant trees in neighborhoods that were identified in a map that University of Chicago created in collaboration with the city of Chicago, that identified the neighborhoods with the lowest tree canopy coverage. So you can see that the average tree canopy coverage is 16%, and in underserved communities is about 4 to 10%. And so this project is to plant trees in communities that are historically marginalized and underserved, and these were primarily on the south and west sides. A really cool component to this program is the Tree Ambassador Program. And so the Tree Ambassador Program is where they train and pay community members to go through a training about trees, native trees, what trees provide us, the positive benefits of trees, some of the misconceptions of trees, because there are a lot of them, especially in cities. And then they go door to door or have meetings with their neighbors to talk about trees, answer any questions, answer any concerns, and encourage them to basically dial 311, because that's what you do, to request that a tree is planted in their parkway. Next slide, please. So these are just end of year numbers from 2022, to just show, that they've actually planted almost 19,000 trees. This was as of 2022, so they planted more now. And then the map shows The map shows where, and then the table identifies the communities that were prioritized, originally prioritized, and you can see that they are planting more trees in those prioritized neighborhoods. Next slide, please. The next built environment example strategy that I want to share is also in Chicago, and it's the 606. And if you're not familiar with the 606, it is a rails to trails project where they converted abandoned train tracks basically into a trail, and it goes through a number of neighborhoods, and they're really amazing. This isn't the only one. There's the High Line in New York City. There's one in Atlanta, and I'm blanking on the name of it. And they're really great programs. The reason why I'm including this one is because while built environment strategies are amazing and they have so many co-benefits, we also have to think about the unintended negative consequences, and gentrification is one of them. And many advocates said this is going to push people out of homes in neighborhoods that are historically low income. And it did, because it, from the price, it's primarily property taxes. And these prices went up 344% in 7 years. Because when you have more green space, you have access to trails, you have parks, you have bike accessibility, walkability increasing. People with more money are going to come in and purchase, right? And I'm not a gentrification expert, but I do know that there are ways to try and prevent that from happening. Next slide, please. I'm going to leave you with another amazing co-benefit from green space, and that is connectedness, right? So I like to think of this as social infrastructure. So there was this amazing opportunity in Chicago with the Robert Taylor homes, which were built in the 60s and 70s, and they were built, and there were different building managers, property managers, and there was green space in all of them. But some of the property managers decided it's too difficult to manage. So there was this natural experiment of people that had access to green space and people who didn't. And what they found, there were researchers from University of Illinois Urbana-Champaign that found people in buildings with greenery were more likely to know their neighbors, speak to their neighbors, know neighbors on a first name basis, and rely on their neighbors for a favor. So just these are social, really mental health co-benefits of strategies that we can do to address climate change and the public health impacts. And that, I think my time is up, and that's the end of my presentation.
Thank you, Elena, for discussing how different communities across Illinois are tackling climate change and public health issues, and really especially the role of education and grassroots community engagement to prepare these communities for climate change and addressing health impacts. So thank you so much. With that, I would like to open up the Q&A. We have about 7 minutes. And if anyone wants to be unmuted, please let us know in the chat, and we will also go ahead and unmute you if that's easier. There's still time to ask questions to our experts, so please submit any questions that you may have. While we are waiting for any questions, speakers, Dr. Downey, Elena, Sarah, if there's anything you would want to add, that would be great as well.
Can I ask you all a question?
Yes, please, we have time.
Sure. How does your agency connect the dots for people about how this impacts their health? Because, energy costs may be a far out thing. You're introducing technology to places that might be suspicious, but health is something everybody can relate to. So how do you all do that kind of very delicate mix?
Sure. We have a couple of subject matter experts in our call. I just unmuted Anthony, Sarah. I also see our director, Brian Granahan, on the call. So anyone that wants to jump in and provide their thoughts, that would be great.
Hi, I can talk to this. You're right, it's a delicate balance. I think the thing that was difficult for me in preparing for this is that the electricity sector is not just Illinois. We live in a multi-state region. So the air pollution that Illinois experiences is influenced by the activities of those other states. It's also very difficult to connect an individual project with an individual wind or solar project with a measurable discrete reduction in pollution. And so we do not actually kind of make claims to our customers about direct health benefits that they will see, or that, their individual project will definitely reduce pollution in their neighborhood, right? Because pollution is also very local. But we try to communicate that they are part of a larger trend towards adding generally more solar to the grid, which will benefit everyone. I don't know if anyone else on the IPA team wants to add to that, but that's kind of how I think about it.
Thank you, Sarah. Just seeing if we have any more questions. Okay, we're, again, like I mentioned, we are providing contact information of our speakers at the end of the slide as exhibited here. So if you do come across any questions after the presentation, please do feel free to reach out to Dr. Downey, Sarah, or Elena. And I really want to thank our wonderful speakers for taking the time to put together such an insightful and educational webinar and working with the IPA. I know you're all very busy, so thank you so much. And the webinar also wouldn't have been possible without the support of our stakeholders and attendees who take really keen interest in joining our session each month. So thank you so much. And we will see you at the next webinar, which will be taking place on May 23rd. So stay tuned for more information on the IPA website. Thank you. Thanks, everyone.